So good afternoon students, again welcome back to our channel Ach'z. So in this video we are going to discuss about OET writing subtest. If you are already started your preparation from long back, in the sense maybe you know these all facts, so this video is for the beginners or those who just started to prepare for OET test. So OET writing subtest is a 45-minute profession specific test, we can say, which consists of a single task. In IELTS and all, we have two different tasks. Task 1, task 2, write that. In task 1 of general, we are writing letter. In IELTS, same like that. In OET also, you need to write a letter. Letter may be in any form, transfer letter, reference letter, okay. So the complete task will be for 45 minutes. In that 40 minutes you will get to complete the task, and 5 minutes is for your preparation. Prior to the writing, you will get 5 minutes to prepare. So that time, what are things you want to check out? So in this 5-minute time only, you need to read out the case notes provided regarding the patient or his or her treatment, or what are things you need to include in your letter. So many things or so many content will be there in your case note. You need to read out this during your 5 minutes time. And about your task, you need to write at least 180 words. For healthy limit, we can just say 180 to 200 words. Along with this information, you can write what kind of letter is to be written. Okay, so that's regarding the word limit and all. So if a nurse is going to write the OET test, in the sense, they will get the task related to that. If it is a dentist is going to write, in the sense, they will get their task related to the dentistry. So according to the medical, that means around 12 healthcare professionals can able to write OET test. So according to their field only, they will get the question. That means they want to write the letter. The content will be based on that. So what all are the preparation you want to do before attempting the question? So first of all, you need to go through the instructions. And about the format of the case note, what all are the things they mentioned in that. So you need to go through the instruction first. And while reading this, there will be so many information will be there in the letter. So you need to check out the end portion first. Whenever you get to the time, begin reading the writing task section at the end to find out what sort of letter you need to write, or to whom you want to write the letter. So always try to check out the end portion to identify what type of letter and to whom you want to write the letter. So that is the first thing you want to check out, rather than reading from the first to last. Then after that, read the entire case note, starting with who you are in relation to patient. That means whether you are a community nurse or it is in a home setup or hospital setup, emergency department. Okay, so these all things you need to identify. Then continue reading the case note. You are not allowed to underline the things during this 5 minutes of time. Okay, so that time you just want to practice eye reading, and you can just use your mind to save everything, because you are not allowed to underline anything during this preparation time. Okay, then after that, during your 40 minutes time only, you can just underline and you can make some notes and all. So it's always good to do that. During this 5-minute time, you need to plan everything. Okay, so whether what all things you need to include in your letter. So many informations will be there, so you need to be more concise in your presentation. Concise in the sense, you need to be legible and it should be brief. It should include all the relevant data, but it should be in a brief manner. So that is called presenting in a concise way. So that is very important. So you should identify to whom you are going to write the letter. If you are writing a letter to the GP, that means the patient is regularly consulting a GP and he already knows about the complete history and all, means you don't want to write about the complete medical and family history in your letter. So you need to check out to whom you are going to write the letter. According to that only, you need to include the data. Okay, so you need to be more concise, you need to be more selective, Okay, so avoid writing additional patient information in your letter, which is not mentioned in your case. That is the another thing you need to remember. That means you are not allowed to write any assumptions, predictions. Okay, if in the case not, they mentioned about something related to the condition or the symptoms and the signs which the patient are showing, but they didn't finalize in any diagnosis. That time you are not allowed to write your assumption. I think this is this case. You are not allowed to write like that. They don't want your predictions, assumptions, anything. That in the case of diagnosis or in the treatment purpose, anything. Okay, you don't want to write anything from your side. You just want to analyze the data provided in the case note, and you need to be more selective. Okay, so no need to write any additional information, no need to write any irrelevant information. You need to be more selective. Okay, and write your letter referencing information from the patient note. Okay, what are the references they mention? You need to write according to that only, and it should be in a brief manner. So the next thing, you need to concentrate on your tone. You know that OET is a formal exam. OET, IELTS, everything is a formal exam only. So you need to use the formal language. So here, according to the person whom you are writing the letter, based on that only you need to use the vocabs. So if you are writing the letter to a healthcare professional, doctor or something like that, means you can use the medical terminologies because he is used to that. They know about that. But if you're writing a letter to a layman, like any caretaker or any bystander, in the sense you can't able to use this type of terminology because they don't know about them. So use your common sense while using your vocabs. So that is the next thing you need to remember. And along with that, the tenses. You need to use, or you need to pass on to different tenses like past, present, future, according to your sentence construction and according to the circumstances which they given. So try to be confident about the tenses, at least about the auxiliary verb and all. According to the tenses, how? That means the tenses is forming because of this auxiliary verb only. So try to take care about that. And also your vocabulary, sentence construction. If you are not confident to use or write the complex sentences in the sense, no need to attempt for that. Because if you are confusing while writing your letter, in the sense, what about the person who are reading it? So they can't able to understand anything. So better it should be in a simple manner. If you don't know to construct a complex sentence in the sense, so try to use simple sentences. It should be in a legible manner. It should be easily understandable. If the examiner is struggling by reading your letter and all, they are reading once, twice and all, they are not understanding in this sense, you will lose your score. So it should be understandable, it should be legible, and it should be in a relevant manner. Then at last, one more thing. Aim to complete your letter at least 3 minutes before the end of the test. Then only you will get time to reread and autocorrect your mistakes. So we all know that our brain first and our hand will be second. That means the brain will go first. Maybe our hand will not be that much fast. We think that yeah, we already written those things, or we just maybe because of our tension some spelling mistake may happen. So it's better to reread at last. So try to leave some time for that too. So that's regarding the preparation part for your OET writing. I hope you understood regarding the points, and in the next section we will go systematically. Okay, so in the next section we will check out with the criteria and some magical tips, and also stay tuned for more updates. Thank you so much, and God bless you all. Thank you.